Welcome to my channel. Today I thought that we would talk about reasons that you may have a low milk supply. I am going to be looking to the left because I'm going to be glancing at some of these points to make sure that accurate information. Let's get started. 10 reasons why you may have issues with milk supply. The first one, insufficient glandular tissue. Sometimes a woman can have, their breasts don't develop normally. So they might not have a lot of the milk making ducts. That being said, there are steps that you can take to maximize your milk supply. I do have a video on increasing milk supply. Pumping. You can talk with the doctor about a medication that can help with milk production. So if you possibly have insufficient glandular tissue, again, this doesn't mean that you cannot breastfeed at all. You just might not be able to be exclusive. I'm going to leave this information in the description below so that you can check it out and read it. And if this is an issue you think might be your problem, you can look into it further. Next one, number 2, is hormonal or endocrine problems. Some women have polycystic ovary syndrome, and that's common in some women. Another is a low or high thyroid, diabetes, high blood pressure, or other hormonal problems. Some women do have problems with hormones, and this can cause not only difficulty breastfeeding, but difficulty conceiving. So any of these things can cause or contribute to a low milk production, because your body does rely on these hormones and these signals to be sent to the breast. Sometimes just treating those health problems will help boost your milk supply. Other cases, you may have to supplement. Going to a breastfeeding clinic or seeing an IBCLC, they can really help you and be more specific to which condition you have and what you could do to help. And it might just be supplementation. It might not be something that you have to stop breastfeeding altogether. Another cause could be breast surgery. It does not mean that you cannot breastfeed, but in some cases when a person has breast surgery, it can cause, this milk supply issue. I'm going to read a little bit of what it says. Breast reductions or enhancements are increasingly common. Nipple piercings can also be considered a kind of breast surgery and can damage milk ducts in the nipple. How much these surgeries affect breastfeeding varies widely depending on how the procedure was done, how much time has passed since the surgery and the birth of the baby, and whether there are any complications that might have caused scarring or damage to the breast. Some women, especially those with breast enhancements rather than reductions, may help to exclusively breastfeed without any difficulty. Others may need extra help and may have to supplement. It just depends on how much damage was done to milk ducts, whether it was in the nipple or in the breast itself. So it just depends on how the surgery is done. If you're considering having surgery done, it's something you can talk to the doctor, the surgeon, about. And if they know that you want to breastfeed in the future, they can find a way to have as minimal damage as possible to the breast so you can still breastfeed. Another one is using hormonal birth control. Birth control many times does dry up milk. And therefore, even some as small as just progesterone only, I know it affected me. Some women it has affected. And so if you're not paying attention and you think, okay, this isn't going to affect my milk supply, you don't recognize it until it's too late, or until, the problem, comes, and then you have to deal with that. The first step in increasing your milk supply after this would be to stop the medication. But of course, you'd need to talk to your doctor about that and talk about other birth control methods, and what you can do to boost milk production. Another one is taking certain medications or herbs, things like that have pseudoephedrine in it, such as Sudafed and other cold medications. These can affect milk supply. Large amounts of sage or parsley or peppermint can affect your milk. If your supply has dropped and you've been taking any of the things, any certain types of these medications or anything in particular that's new, you could talk to your doctor about it and find out if there's alternative treatment. And of course, increased breastfeeding and pumping can help you build your milk production again. Another problem is sucking difficulties or anatomical issues. So this could be more with your baby. It could be the baby is tongue-tied. If they can't move their tongue out of their mouth, then they most likely will have problem. Another one is like a cleft lip or a cleft palate, which can affect sucking. And so this can cause it as well. Now with mom, if your nipple is flat or inverted and the baby's just not getting on the breast deep enough, this can affect it as well. Another one that many women might not think about is not feeding at night. Your progesterone is at its highest at night, and progesterone is your milk producing hormone, or not progesterone, prolactin. Prolactin is the highest at night, and that's what produces milk. And so if you're breastfeeding at night, it keeps those hormones up and keeps it making the milk. But if the baby is sleeping through the nights and you're not getting those breastfeedings at night, it really can affect your milk supply. And a lot of it is established, your milk supply is established in the first month. And so if that baby is already sleeping through the night at day 5, you could possibly have some milk production issues. So definitely something to consider. The next one is scheduled feedings or pacifier use between feedings. So if you're just scheduling when to feed and not feeding on demand, this can affect milk supply because the baby's not eating when they need to. And this can affect how your milk, is being produced. And pacifiers between feedings. So if a baby needs to feed, they usually will let you know. But if they're sucking on a pacifier, you may not be feeding when they actually are wanting food rather than just the sucking that's calming them. Another one is birth medications or jaundice. So birth medications can really affect it, such as like pain medication and sometimes medication they give you with C-sections. This can delay your milk onset, things with epidural, those type of things. And these can affect the baby's ability to latch on. They're a little sleepier. Jaundice, which is one of the biggest reasons with jaundice, is babies tend to be more sleepy. So when there's birth medications given or when the baby is or has jaundice, then it makes that baby extra sleepy, which is harder to get them to wake up and feed, which then doesn't help with the milk producing hormones, and this can cause a low milk supply. As long as you can get that baby nursing well again, pumping or whatever you need to do to increase that milk supply, you should be okay. Again, the very last one is supplementation, which we kind of talked about, and I am going to make a video all on its own about supplementation, so I'm not going to really go into it. But if you're using formula in those first few weeks, this can affect your milk supply again because your milk supply is trying to be established in that first month. So those first few weeks determine your milk capacity, how much milk your breast can hold. And so if you're supplementing with formula, it's going to affect your milk supply and how much milk your breast can hold. And we really don't want that to happen because that can be harder to change because now the body, there's only a certain amount of time where your body's laying hormone receptors. And once it stops laying those receptors, it's not going to lay anymore. And so if you don't breastfeed as much as possible in that first week, those receptors are getting laid in that first week. Those receptors are like tanks. They hold the milk. And so it's important that you breastfeed as much as you can so those receptors are laid. And that's where hormones attach, and that's where your milk is going to be produced. So the more you can breastfeed in that first month and try not to supplement, the better it will be for you. So those are just 10 reasons why there could be more. If you have any questions, I can go further into maybe one or two, one of these in more specific detail. I hope that this answers any question you might have and that the video helps you, because that's really what, it's intended to do. Is if you're out there looking for, could I possibly have a milk supply issue? If nothing falls into these 10 things, then you might feel a little more confident in your ability to make milk. So I will talk to you guys again in my next video, and you guys have a great day.